Good afternoon, everybody. Welcome to another Mancoll Minute. So we've gotten some questions here in the practice come in through the Instagram about an inner thigh lift or a thigh lift, and what does that, where's the incision, what does that mean, what sort of solve. So I thought I'd take a few minutes and just kind of talk about that. So I see two kinds of thigh lift patients in my practice. I've got those folks who've just lost a lot of weight, and as a result of that, they've got droopy bellies, maybe droopy breasts, droopy back and butt, but also the thigh skin, both outer and inner thigh, is affected. And the way I approach it typically is going to be thinking about the thigh skin that's on the outside and buttock is one unit, and then the inner thigh is another. The outer thigh and buttock is usually caught up in what's called a lower body lift. That's how we repair that. That can sometimes be done at the same time as a tummy tuck, but the inner thigh to me is a much more delicate operation. And the reason I say that is the thighs are not this cylinder. If they were a cylinder, you could kind of do what people do. They come in, they grab their thigh skin and pull it up and say, that's what I want. I don't like the bagginess over my knees or the bulging at my knee side, that pooch on the inside. But the problem is thighs are really conical. So you've got a bigger top than the middle than the bottom. So you can't really solve in that old-fashioned way of just making an incision in the groin crease a thigh lift. And the other problem is you're working against gravity now. So no matter how much you pull it up, no matter how happy folks are at like that 2-3 month mark, by 6 months you get some relaxation back. You start seeing that creepiness over the knee to some degree. And you can also have a scar that tends to migrate down because it's all hinged on that kind of inguinal area, that groin area. It kind of migrates below the bikini line. So kind of the modern inner thigh lift has really got more of an up and down incision. And if I just kind of use this picture here as an example, you're really going to have an incision that runs kind of in the groin line and then on the inner thigh, and it may even go sort of backwards towards the buttock crease. So you're sort of bringing tissues upward and you're also bringing it around. And it's very good operation for tightening. It doesn't allow necessarily for all the scars to be hidden because of that up and down incision, but ultimately scars become a trade-off. And that's something you have to really think long and hard about is, what am I wearing most of the time? How much of that scar impacted versus might be able to get into shorts or skirts that I haven't worn in years because of all that loose skin. A lot to talk about. I'd love to have that conversation with you, but that's sort of a general overlook of the inner thigh lift. And I'll save the outer for a different conversation because that goes more with a true surgical buttock lift, and I think it warrants its own time. But if you have interest in an inner thigh lift, you don't like that poochy area right above the thigh, kind of the upper thigh, the loose skin, let's talk about it. Anyways, have a great rest of your week, and I'll talk to you soon.